All right, here we go.
So, Luna, you've joined us a few months ago here at Greenepsych, and one of the reasons I was so excited that you said yes was because you have experience as a counselor, you have experience as a sports psych, and you have experience in the world of trauma-informed care. But I think there's some education around those of us who haven't been trained in the way you have been around what's the difference between a trauma-informed clinician or a sports psych and a trauma-trained clinician or sports psych. Can you give us the skinny on that?
Yes, that's a very good question and helpful to know the difference. And so basically, trauma-informed therapist or trauma-informed sports psych would be someone who has done some education around how trauma impacts people's lives, but doesn't necessarily treat trauma as much. It just has that general understanding of how trauma can bring triggers up or change the way people behave and interact with others. That's trauma informed. Now,
Okay.
trauma trained therapist in this case would be someone who's done some sort of formal training that allows them to practice some sort of trauma therapy. And so an example would be, CBT for trauma or EMDR. And those are very specific modalities that require therapists to get training for it. And so in those cases, clients would be seeking them to specifically address their traumatic pasts.
Got it. And you yourself are trauma-informed or trauma-trained?
In my case, I'm trauma trained. I have training in EMDR, and so
Right.
I can help my clients kind of work on some of their traumatic pasts, depending
Right.
on the needs.
Right. I did know the answer to that, but I wanted you to say it for yourself so the audience could hear.
Mhm.
Now, if you're an athlete out there listening and you're thinking, well, I have had some trauma, but I really want to work on my performance on the field, in the pool, on the court, um, how do I make some decisions about which way to go? Trauma informed, trauma trained? Do I
Mhm.
need to, do I need to see someone who's in trauma? What are some of your key recommendations?
Yeah, that's a good question. Well, I think depending on the goals, what you're trying to achieve, let's say you have experienced some trauma, but you really just want to focus on your sport-related concerns or ways to improve your sport-related performances. I would recommend looking for someone who is trauma-informed. And so this can be a therapist or this can be a sports psych consultant. So they'll be helping you improve your performance, but they would also have that background understanding of how trauma may affect you. We know athletes tend to be very mentally tough and very resilient people. However, we also know that they're, just like anyone else, susceptible to experiencing traumatic things. And so whether we see those connections or not, I think it's important that there is someone who can help you feel safe and at least be educated on how it can affect you as a human being. But then if you, let's say, want to work on both your traumatic past, but also enhancing your performance, making you a better athlete, I think looking for a therapist who has training in sports psych, and then also looking for someone who is also at the same time trained in some sort of trauma modality can be very helpful, because this person then can help you kind of address both things, not necessarily at the same time, but depending on the plan and what makes most sense for the client, kind of get to the both and resolve both concerns.
Is that how it works? If you were working with somebody who's trauma trained and you're an athlete, you could kind of with the therapist have a conversation about how much you want to spend on the sport, when you might want to work on the trauma. You can kind of go back and forth a little bit. Is that how it might look?
Yes. I mean, that's how I usually approach it. I try to kind of share the decision-making process as part of being trauma-informed, is sharing that power with the client as much as possible. And so based on their goals. So let's say, for example, they have a really big game coming up. In my case, doing EMDR can be stressful for clients and sometimes can reopen some of the old wounds initially. And so maybe it's not a good idea to dive straight into reprocessing trauma, couple of days before they have a big tournament, let's say. So that in that case, I would recommend maybe let's stick with preparing for the tournament. Once that's over, we can dive into the past and then help you resolve the trauma.
That's a good example. So if you're an athlete out there, our last question, your best advice for them if they're trying to figure out how do I find a trauma informed or trauma trained therapist? Is there something I should be looking for, or paying attention to? Do you have a few tips there for them?
Yeah, I think it's very helpful to ask people that you're considering meeting with. So you can ask even directly, like, have you done any training in trauma-informed care? I think it's important to ask these questions. You can also ask, do you consider yourself trauma-informed? And what does this mean for you? I'm sure for every therapist that can look slightly differently. What is your approach with clients who have traumatic histories is another important one, because again, it's going to look slightly differently. At what pace do you go when working with trauma? Again, another important one. You can even ask, like, are there any limits to your competence? Are there any types of trauma you're uncomfortable working with? And so that can help you decide if this is a good fit. But the basic, I guess the most important thing is that you feel like it's the right fit. And so asking the questions that can help you decide that.
And I think I've heard you once say people even in their bios, more and more
Mm-hmm.
professionals are putting in their bios whether they're trauma trained or trauma informed. So that's even a very just a practical way to know if
Yes.
if somebody is tuned into that.
Mm-hmm. They'll
Um,
usually, that's a very good point. I'm glad you brought that up. Usually they'll specify if they're trauma trained, what type of trauma training they have, or if they're trauma informed, they would just bring that up in their bio, in their approach. So you can definitely read about that too.
Great, great. Well, I really appreciate you hopping on quickly for just a few minutes of education for those of us out there who need more education around trauma-informed care, and trauma, and trauma therapy in general for athletes. If someone wanted to follow up with you, had questions, what's the best way for people to reach you?
Well, probably my work email. So it's my first name, Luna at greenepsych.com. So just Luna, very simple. Have access to my email all the time. But yeah, welcome any questions. If anyone needs help figuring out what's the best fit for them, or just in general, happy to answer.
Great, great. Thank you for your time today, Luna. We appreciate it.
Thank you for having me. Bye.
Okay.